Today on Vital Insights.
If hospital at home can be used as kind of a beachhead in an initial episode of a highly acute, with highly acute requirements, but it can be established with a beachhead that creates that long tail for the patient, then I think it's a real win.
Welcome to an episode of Vital Insights, a podcast series focused on thought leaders and healthcare providers who are working to transform the way we care for patients, now and in the future. So, Matt, one of the things we're hearing a lot about right now is the hospital at home movement. I think partly probably driven by the COVID-19 pandemic. But let's talk about the staying power of that movement. Mm-hmm. So as an industry expert and kind of for purposes of this conversation, how would you personally describe hospital at home?
This allows for a certain really specific type of patient to get care in a more comfortable care setting and to get better clinical outcomes. So hospital at home programs have been successful, but first, what are they? So think about a person that is sick enough to require an acute care hospitalization,
okay,
but also has would be hospitalized for a condition that is treatable in a home setting, meaning doesn't require other hospital services frequently, and doesn't require a series of parade of specialists to come visit the person. So that type of patient is typically a person with a chronic illness. So congestive heart failure is a great example. CHF is a great example because it has a predictable care path. A hospitalization is something that can be documented and programmed. And so that person can have care in their home by an acute care provider or hospital, setting up essentially a hospital room in their home that has certain things that are standard in a hospital room, and then also things that are different because the person's at home, those things mostly being connected technology. And the person, while they're at home, is still going to have care. It's still an acute care, a hospital care episode, and so they're still going to have nurses and doctors who visit them every day. Some of those visits may be virtual, but this is still an acute care episode. This is a person that could easily be hospitalized. They're sick enough to be hospitalized. And so the care that they need is still essential. It can just take place in the home.
So what do you see as kind of the long-term longevity for this movement?
Yeah, look, I mean, on the one hand, I really like a lot about it. And I think that the early pioneers in the hospital at home movement have increased capacity for the acute care hospital beds. I mean, that's kind of the base and essential component here. But they've also had better clinical outcomes for a lot of these cases. And so to me, it's not just the mechanism of hospital at home. It's sort of the confluence of that mechanism plus the patient type. So if what we're talking about are chronically ill patients, we have to think about them much more longitudinally. We can't just think about a single episode. And so the real question becomes, from my perspective, the real question becomes, how can we deploy a hospital at home setting so we get that better clinical outcome? But then how can we use the fact that the person's in their home and we're deploying connected technology to create kind of a long-term solution because these are chronically ill patients, right? And so if hospital at home can be used as kind of a beachhead in an initial episode of a highly acute, with highly acute requirements, but it can be established with a beachhead that creates that long tail for the patient, then I think it's a real win. I think if it's an alternative episodic engagement for the patient, then I think you're limited to kind of like the baseline yield of a slight increase in hospital capacity and slightly improved, better clinical outcomes for that episode. But I think that's really foregoing like the really cool and interesting opportunity, which is to let's create the beachhead and let's create a long tail for these chronically ill patients.
So in terms of thinking about that patient, so I'm a patient who just had an episode. I come home, I've just been discharged. I don't mind being a patient for a little while.
Sure.
But in that long tail scenario, I might get a little tired of it. Right. So how do you see that kind of flipping or morphing to take those considerations into account?
Yeah, no, look, it's exactly right. So a hospital at home episode gets us part of the way there, but not all the way there.
Right.
Right. So it's a little less expensive. It's perhaps, hopefully, a slightly better clinical outcome. But what we should be really asking is, how can we use that episode to kind of elongate the period of care? Well, as you know, people don't want to be patients all the time.
Right.
We all want the good news, which is that, hey, all clear, your episode's over, get back with your life.
Yeah.
But if you're a chronically ill patient, that's really not the future. The future is, how can I take better care of myself and this chronic condition over the long haul? And frankly, how can I reduce the incidence of these episodes? And so I think that the real opportunity, at least from my standpoint, right, from the kind of the population health perspective here, I think that the real opportunity is to take what is otherwise episodic, that has a really clear end. I'm discharged, I've left the hospital, now I'm home. It's totally different, right? And it's to take that episodic thing and to spread it out over time. So you're creating a relationship with certain connected technologies. You're creating a relationship with different connectivity opportunities with care providers. And then you're asking the person to kind of include that long tail in their care. And I think there's a tolerance for that can come from the end of a hospital at home episode that's different than an acute care episode. And so that, to me, that's the real opportunity. And so certain times in some programs, you see hospital at home that has like kind of a care tail after the acute care episode ends. Sometimes it's 30 days, sometimes it's more. That's monitoring and engagement, right? And it's teaching and it's compliance and it's other things that are really beneficial. And these things have real health outcomes. But from my perspective, if you and I at the very beginning looked at the data and we forecast that a certain chronically ill patient was going to have 4 hospitalizations in a year, and instead we've converted that to 4 hospital at home episodes in a year, I don't think that's really a success.
Right.
And so the real question is, how can we take that first incidence and how can we convert that to a better longitudinal care plan?
So how do we turn that story into a patient empowerment story?
Right.
How do we give them control of their own health? How do we kind of flip the coin over to the other side?
Yeah, I mean, so much of it, I suppose, has to do with technological adoption. And at the end of the day, a hospital at home episode is no more empowering than an acute care hospital episode inside the 4 walls. It's still pretty intense. I mean, these are sick patients that require acute care. But on the other hand, by creating this notion that you can provide this care at home, you are sort of empowering a person to say, hey, look, you don't have to go to the 4 walls to get the care you need. And as a lot of the teaching and training and education is going to be during that episode, hey, maybe we can even use some of these things that are here during this hospital at home episode to kind of engage with the healthcare system better so that you can take better care of yourself going forward, right? And so the old model of managing your chronic condition at arm's length and then occasionally going to the hospital when you have an exacerbation, like let's hope for and let's build programs toward the end of kind of eliminating that as an outcome.
That's fantastic. Well, thank you so much for joining us today.
It's a pleasure.